We are now to the point that we'll take questions from the group and have, I'm sure, a very stimulating discussion. We have a couple of people with roving mics, and so if you want to ask a question, you put up your hand. Please do not ask your question until you get the mic so everyone can hear. So anyone have a question? You're like my students. You just sit there. Oh, yes. Okay, Andrew.
Sure. This question is for the entire panel as well. What role do you think physical education can play, and do you think that we could benefit from a federal mandate for physical education?
I mean, there's no question that not only do we have an obesity epidemic, but the obesity epidemic is starting in our kids, and that was unheard of many decades ago. And now, you know, typically kids are not out on the streets playing all day. They're playing on computer games, they're watching videos, they're watching TV, besides eating fast food. So their physical activity has markedly declined, and we're seeing obesity and even diabetes develop in kids, and that's going to lead to increased atherosclerosis and cardiovascular disease risk. And so certainly, I don't know that we can totally depend on schools to increase physical activity. We need that to be done, you know, throughout a kid's environment, and certainly the parents need to increase physical activity in themselves, and the kids follow suit, and that's probably the more important. But I think from the standpoint, school would be a way to assure that all kids are getting a modest amount of physical activity on all or most days. So I would be in favor of schools having physical education, and unfortunately many schools, as we know, have taken it out of their programs, and some don't have physical education at all in their programs. And so I hesitate sometimes about mandates, but I think this may be important enough that in some way being part of an education curriculum that includes physical education, basically having PE the daily or at least several times a week would seem very, very reasonable.
Okay, let's hear what Dr. Hill has to say.
So I believe it's critical that kids are active during school. If kids came home from school being active an hour a day, we probably wouldn't be here talking about childhood obesity, put simply. Now, whether physical education is the way to go or not, I don't know. There was a lot of really poor physical education back when we had physical education. So I hesitate to say you have to do that. If I were king of the world, Steve actually is, but if I were king of the world, I would mandate that every kid every day has to be active an hour, whether that's taking a walk or whether it's physical education. I don't think it much matters. I would love it if we had good physical education. Key thing is to get kids to move. And what we found is the way you really get schools to get interested in that is show them the data about physical activity and academic performance. Schools are there to teach kids to learn. They're not against health, but their job is to teach kids to learn. We now know that kids that are eating well, kids that are physically active, and kids that are a healthy weight learn better. That's the way we get into schools. We got to get kids moving. PE is one way to do it, but there may be other ways.
Yeah, really exciting research in the last few years, not only with kids, but even with geezers. Exercise is good for the brain as well as the heart and muscles. Right. And to take activity away from kids in schools so they'll get better scores on the math test is going in the wrong direction. Okay. Other questions? Yes?
I would, if I can, I would jump in too. I would add one thing. I think that what we need to do is we need to teach our kids to physical activities that are sustainable they can do for life. I mean, I think there's emphasis on team sports and individual competitive sports, which are a little bit disconnected from the real world, that you just don't do in the real world. So I think part of it is also, you know, schools are there to educate. I think that Jim said that. I think we can educate people on lifestyle changes, the same small changes that were discussed in a couple of the presentations, that they can then do for life, be it something like tennis, be it something like walking or hiking, cross-country skiing, cycling, something to get at least them started on a path that they can continue with. The other thing I would add too is I would like to see home economics probably back in schools. So if I'm here to represent the diet side of the equation, I think part of the problem is kids don't know how to cook anymore. They don't know where food comes from. And I think part of this issue is if you could empower kids to make the right choices, instead of talking about everything they shouldn't be doing, which is like punishment, you punish your kids, you don't actually teach them what they need to do, the behavior they need to do. They just know what they're not supposed to do. We are creating a bit of an issue here because you're saying, don't eat sugar, don't eat fat, don't eat salt. Well, look at my environment. What can I eat then? And I think if we could teach kids to make their own food, go out, buy their own food, understand where it comes from, I think they can make better food choices.
I think it might be a good idea. I think it might be a good idea to teach them about energy balance.
Yeah.
I mean, that could be part of mathematics and biology, and teach them about behavioral
We're
science,
actually
how to manage
doing
behavior.
that, Steve, as our approach is to, we're doing this with fifth graders. And if you ever had a fifth grader, telling them what to do is counterproductive because they'll do just the opposite. But if you empower them with the skills, then you can't convince them that they're wrong. And so that's exactly the approach we're taking is let's teach them the skills. For example, most adults don't know how many calories you burn in walking a mile. Or if you get the the large French fries, how much activity do you have to do? So if you teach kids simple choices like that, then they're empowered to make their own decisions. So it's not telling them what to do, it's empowering them with the skills and then turning them loose and letting them do it.
Okay, was the question back here, ma'am?
Hi, Marcia Greenblum from the International Food Information Council. I think your statements are all terrific. I think we definitely have learned a lot from it. Can you give me a one-line summary what you'd like the Dietary Guidelines Committee to know? What messages would you like them to know about what you've just said?
Well, it's balance, variety, and moderation. It's that, it's the old dietitian mantra. So balance, variety, and moderation is still the way to go. So in all things, including our diet and physical activity.
I would like to see more food-based and dietary pattern-based approaches. So, I mean, I think that this idea that we're just chasing macronutrients and we can actually take this reductionist approach to the diet and make it all about sugar or all about fat or all about salt, I think it's really wrong-headed, and I think the messaging around that is very difficult for people to actually interpret and do in their day-to-day life. So I think it's, I would like to see more, and I'm part of the Canadian Diabetes Association guidelines, and we introduced it this year, going food-based, dietary pattern-based, like diets that people eat. People eat foods, the foods they eat, not about the nutrients, about foods that can be part of a healthy dietary pattern.
To follow on that, I think we focus far too much on individual foods. This food has a health claim, this food has a health claim. Well, if that's all you eat, it's not going to be healthy. It's harder to do it for diet, but what people really need advice on is how to put the diet together, not what individual foods to eat and not eat.
Okay, other questions here from the group? Yes, sir, in the back. Give him the mic, please.
Hi, I'm Bob Lichter from George Mason University. The panel's just been talking about the role of the educational system. Jim Hill mentioned a problem of a Time magazine article being kind of media misinformation. What about the mass media as an educational system? How well or poorly is it doing, and how might it do a better job?
Yes, how well are they doing?
Steve, I'll start
yes,
on that.
please.
I mean, part of it is we work a lot with people in the media, and it's a tough profession now because we find that people don't often have the time to dive deep into these issues, and they do a superficial job. Saying that, I think it's a way to influence people, and it's a system we have to begin to work with. And we're talking with somebody earlier that, you have a soundbite or you have 300 words to get a message across. That really is tough when you're transmitting science, but it's a system out there to reach people, and we experts have to figure out how to do a better job of helping those people in the media get the right message out.
Absolutely. There has to be good collaboration. I think one of the great problems in our society, whether this topic or anything else, is just the immense amount of material you can get on the internet. And has that been vetted at all for whether it's accurate or not? How do we deal with this so people get the accurate scientific information?
Great example, I'm going to put John here on the spot, as we were looking at a news report this morning. And John, I think it's a good time to bring that up and talk a little bit about what that said versus what you told us the real data are.
Yeah, I mean, there was that report from Fox News today. There was 10 points about what's the problem with diet, low-calorie sweeteners and all this, and none of it makes any sense at all. None of it. None of the points. And we could go through each of the 10 points and correct them, but I guess once it gets out there, it's out there. And what do you do about that?
I would encourage people in the media, when you have an issue like that you want to address, talk to people like this, who are scientists, who are fully familiar with the knowledge, not with the celebrity scientists who, they may have degrees, but are they really open-minded, thoughtful scientists? And I think that's something you could help with. Questions?
You might have touched on this just now, but I'm interested in your opinions on the misinformation about artificial sweeteners. I see these as real diet aids for people who might want to switch to a diet soda or something sweet that doesn't have the sugar. So I'm very concerned about the misinformation, frankly, junk science surrounding artificial sweeteners, which are perfectly safe and could really help people.
John?
I agree 100% with what you said. I agree with you, and it's all, myths die hard. And that's what we're seeing. And, you can put anything on the internet, and all those things. And that's the problem today. And if you look at the science, that's where the issues are. Low-calorie sweeteners are safe, they're practical, they can be effective, they can help. They're small changes. So why not? But then you get, well, you know what you get. So.
Jim?
But this is where the junk science really hurts us. For example, some of you know, I've been following a group of people in the National Weight Control Registry that have kept lots of weight off for a long period of time. And these people are hammered with the message, the only thing you should drink is water. And what they tell us is, I do it most of the time, but I get tired of that. I want some sweet taste. I want something. And they use non-caloric sweeteners. They never consume a caloric beverage, hardly ever. But they say that this is one of the things that has helped them keep the weight off. Because it's great advice to say just drink water, but in practicality, come on. You got to have a little fun with things. And the non-caloric sweeteners give us a way to have fun with no negative consequences.
Other questions? Yes. Oh, I'm sorry, we'll get you next. There's a man in the back, so we'll get him next. No, right now, first. No, I'm sorry. The moderator here needs to be a little more clear in the way he expresses things.
Thank you very much. I'm Colby Tyner with the American Heart Association. This discussion is about non-medical interventions for obesity, and we have seen recently the mass commercialization of mobile healthcare technologies. In particular, there are thousands of apps that have to do with dietary and obesity interventions, physical activity interventions, MyFitnessPal, for example. But the research is scant as far as the long-term effects they have on obesity rates. And I just want to get you all's input on what you all think the long-term effects will be on mobile health care technologies on obesity moving forward.
Well, we have a new center at my university, Technological Applications for Lifestyle Interventions. And we've just hired the endowed professor to lead that center, a colleague of several of these folks, Professor Delia Smith-West. And we need to do this research. Now, I think the research that we've been getting in the last very few years, this is a new area, but it is really quite encouraging. Well, it's not long-term, no, iPhone apps haven't been around all that long, but there are groups around the country and around the world who are investigating these approaches, and I think we need to do the research in the area, and let's see how successful we can be. And my simple-minded comment that I make often when this comes up, I think social media and using technology like iPhones and such, it seems to me in the Middle East in the last couple of years, it got people on the streets to do something more dangerous than walking. So why can't we get them on the streets to walk for that? So I'm sure others, John, yes.
Well, I think we know the package, healthy eating, healthy exercise, healthy behavioral strategies. What's new are these delivery systems. It's how you deliver this information. And that's where these come in. We've done 4 of these. We did one with the Air Force and one in England and just finished one with the food. And they work. They, in my opinion, what we've seen so far is they produce about half the weight loss as coming in for the intensive, like we did with Look Ahead or any of these. But it's certainly the future. So I believe in the future. We need long-term, again, randomized trials, obviously. But I think they're very promising. And it is the future. I mean, there's no question that's where the field is moving toward.
If I can just add a comment to that, John, if you get half the effect from using these mobile apps as we would get with an intensive intervention, but you can reach 100,000 more people, it looks like the population is really great for the population.
So I think they're promising, but I still think weight loss is the easy part, and all these tools will help you eat less in the short run to lose weight. And eating less is the key, and it doesn't matter what you eat less of. To me, the proof is in the weight loss maintenance. Can the tools then begin to be a help over the longer period of time? They are tools. You know, as my colleague said, that's the icing. You still need a cake to put the icing on. The cake is the what to do, the behavioral strategies. These tools are delivery. So I'm hopeful, but I still think we haven't applied it to the real problem, which is how do you keep weight off?
Well, there are studies that have looked at the physical activity piece too. It's not just all been eating less, and those results are encouraging as well. So,
Jim, have you looked at those in the weight registry yet?
We haven't. We haven't. It's a good question to see
Yeah.
to see if they use them. I don't know if they do or not. Great. You give me. I'll go home and do that study.
yes.
Right away.
Just something simple that's certainly effective is the use of pedometers. I mean, that's something that one, it's a way to measure, but it's also a way to provide positive feedback. And certainly corporate America is recognizing the potential value of this by getting their employees to wear the pedometer and then prove that they've done so many steps and then see reductions in their health premiums. And they see their medical costs going out of sight, so they really have the incentive, you know, to get a healthier workforce. They want you want to do that for altruistic reasons, but certainly just from a financial standpoint, it would be a tremendous help, and that has been something that's been very effective.
You know, I'm not a behaviorist, so Dr. Fourette can correct me, but one of the key principles, if you want to change any behavior, is kind of knowing where you are with that behavior, monitoring it, and whether it's counting your calories or counting your steps. And the pedometers and accelerometers allow us to do that really quite well. And I think we've done a fair bit of research that shows, yeah, that is useful. Yes, sir.
As a general question, we talk about increasing physical activity and how important it is. But in that balance, one is increasing expenditure, increasing aerobic capacity. What about lean muscle mass and increasing muscle integrity? How do you balance that out, and weight training versus aerobic activity?
I mean, certainly most of what I talked about was aerobic fitness, and which is increased by general physical activity like the walking, the bicycle, the elliptical machine, swimming. But resistance exercise is also very important, and muscular strength does protect. I mean, Steve and I published a paper that got a fair amount of publicity about a year ago, reviewing all the literature on muscular strength being a very important predictor of cardiovascular risk factors and cardiovascular prognosis. And lean muscle mass always correlates with better prognosis. And from the glucose standpoint, increasing muscle mass is very helpful to improve glucose control. So aerobic exercise helps some, resistance exercise helps some, but when you put the two together, that's the group of diabetic patients who really are able to improve their glucose control. So,
well, to follow on that just a moment, you probably already figured that Chip and I are absolutely brilliant fellows, and we're brilliant at picking people to mentor, and so we've mentored Tim Church, who did a great randomized trial that was published a year or two ago in JAMA, where he took people with diabetes, assigned them to control, aerobic exercise, resistance exercise, or combo. And the combo group did the best in lowering glucose, hemoglobin A1C, et cetera. So yes, and resistance exercise is part of the US and the WHO, the guidelines, 2 days of resistance training a week, major muscle groups. So thanks for bringing that up, Carl. And Jim?
Steve, to illustrate too that it's probably the best thing you can do to oppose aging, because you lose lean body mass as you age. Some of that's inevitable, but those people that exercise lose less. And in terms of total mortality, your lean body mass is a pretty good predictor. So you don't want to lose what you have.
Absolutely. The lady here?
Hi, Kimberly Reed, International Food Information Council Foundation, and you mentioned WHO. Dr. Margaret Chan, WHO and the United Nations have set a goal for the world of reducing non-communicable disease, including heart disease and diabetes, preventable deaths 25% by 2025. And right now we're doing a lot of best practice sharing, and so I think your studies will help add to that. My question is, are there any countries outside of the United States that do some things that we might look to as well as a best practice for our own nation as we try to meet this goal?
Well, one of my favorites is Finland. I mean, they pushed early on improving physical activity in the population. We go way back, you know, Finland had the highest heart disease rates in the world if we go back a few decades, and they really brought those down by massive community-wide interventions, both diet and physical activity. Australia has been doing a great job with public policy, particularly in the area of physical activity. I'm not quite as aware of what they're doing in the nutrition area. But yes, we need to be learning what some other countries are doing.
The other one I think we can learn from, not that they've reduced it, is France, because their rates are increasing a little bit, but not like the rest of Europe. And I think there are some interesting, the ways we approach food, psychological things that we may learn from the French. They don't have what a lot of us would consider a really healthy diet, but they're maintaining lower obesity rates. So there's something going on there that I think we could learn from.
Well, France was the home of the EPOD study, right? And there was real intensive community intervention, diet and physical activity. And I'm not intimately familiar with the results, but they've shown some great progress. John, did you want to comment?
Oh, absolutely. I mean, they have good outcome data, and it works. But, you know, when you have small communities, it's not that hard to do. It's harder to do in a country like the United States, but
harder
like
in
Houston, it would
yeah.
be impossible to do in Houston.
What about Las Vegas?
Vegas, absolutely.
Where he also lives.
Yeah.
Okay, who was next? Yes, ma'am.
Hello, my name is Shrita Bozeman from the Black Women's Health Imperative. I'm actually working on scaling up the National Diabetes Prevention Program and just returned from Los Angeles to see some of the great work we're doing with the city of LA. Just wanted to know, have you seen any more success or impact in terms of group interventions?
And
Group interventions with any of your studies?
well, yeah, John, you want to, or
Well,
Jim?
I mean, look ahead, you know, of course. We have 10 years of data now that we published, and it's based a lot on on the diabetes prevention program. So a lot of the intervention we took from the diabetes prevention program and then just updated it and so on. So 10 years of data shows very effective changes in body weight and maintenance of that weight. So sure.
And if we're talking about the group interventions, one of my colleagues, Professor Sarah Wilcox, has done several studies in African American churches in kind of rural South Carolina. Sarah James Aber and I have another study in African American churches where we're intervening on diet and physical activity, try to reduce inflammation on the colon cancer spectrum. So yeah, I'm a strong believer of getting groups involved.
Yeah, I do too. Yeah.
Social support, John, am I on target there with getting social support? If you're trying to change any behavior, if you can get social support from friends, workers, family, it's probably going to help you.
And that's where the group is so important.
Yeah.
Yeah.
Yes, up here? I'm really impressed. You're all really good. You don't start talking till you get that mic. Thank you.
Hi, Rebecca Golden from George Mason University and Statistical Assessment Service. I would like you to comment on the direction of academia with regard to these kinds of studies. You all began saying that there was a dearth of data, and then you presented actually quite a lot of data. We began with talking about well-respected scientists who are publishing in Nature with questionable results, and at the same time, we really value the peer review process. From my point of view, I see a new focus, which is on fMRI studies, and the focus, and I think misleading attempts to identify patterns of eating with addiction. And I wonder if you would comment as doctors as to whether there's some validity in this sort of approach or whether this is sort of a big red herring that's really distracting us. We're not seeing any of that on exercise. We're seeing it all focused on addiction, so to speak, of sugars and sugars mostly, but thank you.
I guess if I could start. I would just say, I mean, this has really been a pet peeve of mine because I really see it as putting the cart before the horse. I think we have to demonstrate that it's clinically meaningful effects. So when people start marching out these fMRI studies and looking at different regions of the brain that are associated with food intake regulation and addiction lighting up and somehow trying to draw inferences as it may relate to gaining weight and obesity, food intake regulation, so eating more, gaining weight, obesity, diabetes, I think they're really missing the big picture, because I think we have data that shows that if you match for the calories, we don't see the weight gain. If you match for the calories, you don't see the adverse effects on other aspects of cardiometabolic health. Those are more clinically meaningful to me as a clinician. I don't treat fMRIs. I treat risk factors in patients, and I want to prevent clinically meaningful events from happening to them. I don't want them to get diabetes. I don't want them to get heart disease. I don't want them to die prematurely. So I think we have to really fall back on randomized trials. I think that's the highest level evidence we have, and we have to look at clinically meaningful outcomes. And I think if we do find something, then you can go back and do the fMRI and have an academic seminar on why it works and try to explain the mechanism. But trying to put the mechanism ahead of actually showing any clinical effect, I think is really wrongheaded.
There are people working on exercise and some of these issues. I'm part of a large multi-center study funded by the National Institute of Alcohol and Drug Abuse, and it's a randomized trial in people assigned or made to go to drug abuse treatment centers. And typically they're assigned there for 4 or 5 weeks. They get randomly assigned to exercise or not, and those randomly assigned to exercise, they start exercising when they're in the center, and then after they are released from the center, we ask them to come back once a week to try to keep it going. We'll have some data on that in the next year, I think. It'll be interesting to see if it works, but there was enough evidence that this might well work through neural mechanisms to help people stay off the drugs that was causing them the problem. So fingers crossed. We'll see. Jim?
Rebecca, there's so many good points in the question you ask. Food addiction, I think, has taken us down a very, very dangerous path. And I would ask the underlying motivation for a lot of those people pushing the food addiction thing. I think we're addicted to food. Take it away and let's see what happens. But I don't think we get very far trying to blame the problem on being addicted to sugar or fat or this or that. I think you stretch the data to come up with that conclusion. The other thing I think you point out is if you look at the strategies that are out there in the public to address obesity, they all focus on aspects that we've pretty much told you today the science doesn't back up. Where are those strategies that involve both food and physical activity, looking at dietary patterns, looking at the data on substitution, not addition? Where are those kinds of strategies? And to me, that's what's missing. And I think it starts with an understanding of energy balance, but then it's, can we develop more effective strategies than the ones that are currently being put out there, strategies that are feasible, strategies that are consistent with societal values? I don't think we have any of those, and I think those are greatly needed.
Dr. Levy, did you want to make a comment?
I'm a practicing cardiologist, and something that I think that's been neglected in all of medicine, and particularly in cardiovascular diseases, is the important impact that psychological risk factors have on prognosis. And that's things like depression, anxiety, hostility. And we've actually published a lot of papers on the prevalence of psychological dysfunction in our cardiac patients. And basically, for example, depression in our patients with coronary heart disease, about 20% of the coronary heart disease patients meet criteria for depression. And following an exercise training program, we are typically seeing 50% reductions in the prevalence of depression, anxiety, and hostility. And more importantly, these adverse psychological characteristics are associated with higher mortality. And we've correlated the reductions in mortality with exercise training have correlated with reductions in psychological stress. And then to carry it one step further, we showed that we showed that those who improved their cardiorespiratory fitness had very marked reductions in depression and depression-related mortality. Yeah. Those who didn't improve their fitness didn't have either. And one added importance, that we showed that the benefits occurred with just small improvements in fitness. The group who got a small improvement in fitness got the same amount of benefit as those who got the large improvement in fitness. And again, this is in coronary patients, but if this is applicable to outside of coronary disease, it can have a profound impact, and it would suggest not only can patients improve their prognosis, but they can improve their psychological stress and psychological stress-related mortality with just a small improvement in overall fitness.
John?
Just fMRIs have been dubbed by some as phrenology of the brain, you know, and it's just a cart before the horse. I agree with John. We just need so much more information. From a clinical point of view, you know, it's not very practical. So we still, what Jim said is we know the way to treat, or at least we know what's going on. And so it's just too soon to say anything about fMRIs as any practical significance.
To just pick up a moment on the depression, one of my colleagues did a great randomized placebo-controlled trial in patients with depression, and the ones that walked 180 minutes a week at 50% of capacity had reduction in depression symptoms that are equivalent to what the meta-analyses show for drugs and cognitive behavioral therapy. That's not to say it's better, but it's equivalent. So then with Dr. Trivedi, we did another study where we got patients that and he's one of the top psychiatrists in the country dealing with these issues, where he had failed to get remission of their depression with standard medical approaches. We then randomly assigned them to exercise, and they didn't all get better, but there was significant improvements, and many of them got better. So exercise, it's good for the brain. And just one other quick thing, quality of life. There have been a lot of good randomized trials in patients who have cancer and then randomly assigned to exercise or not. Quality of life improves. So whether it prevents the cancer, which we do have some we do have some evidence on that, but you're feeling better while you're living. Is that a good idea? Yes. Okay, who was next? We are getting close to the end, but we can take, yes, go.
Back to the, Bob Karsh, American University, back to the question of youth, particularly in the youth and physical activity. We seem to have, at least in the US and I think in other countries as well, sort of this bimodal distribution. We have bigger, stronger, faster, more highly skilled youth than maybe we've ever had. And on the other side, we have a pocket of young individuals that are already predestined for clinical conditions, early diagnosis of. How do we balance that out? You know, we're in a society that has the best and the worst at the same time. You made some comments earlier about physical education in the schools. What are your recommendations specifically about that?
The latter group are really good video game players. No, I think you're right. I think if you look at where the resources go in most schools, they go for the sports teams, the elite athletes, and we don't have much for the others. So we have to find a way to spread it out, because I think there's a sense of we don't value kids just being active, we value the ones that perform well. So I think what you're talking about is a need for systemic change in how we allocate resources to activity. And back to the schools, I think our way in is through academic achievement. I think that's what schools care about, and that's the argument we have to use to make some of these changes.
One last question, anyone? Well, we do certainly thank you all for coming this morning. I hope this brilliant group of panelists has provided you with information that you'll find useful, and I'm sure if a thought occurs to you as you're driving home, they can be assessed by email. So thanks again for coming.